Welcome back. What if there was a way to catch life-threatening diseases years before symptoms appear? Well, good news, there is.
Yes, Longevity Health provides next-generation heart and full-body imaging, saying it's the gift of life. We're here with Dr. Kevin Young. Welcome in.
Thank you. Appreciate you guys having me here today.
Glad you're here.
Let's start with just why even have screenings? Why is it so important?
So, one of the things that we're really committed to, and our founders, George Shen and Megan Shen, were committed to starting a program for patients and people here in Middle Tennessee where we can evaluate for cancer and heart disease early on. Those are the number one and number two causes of death in America, are heart disease number one and cancer number two. And one of the things that we're really committed to is being proactive about finding these problems early and then taking care of them early on to increase people's life expectancy and quality of life as well.
So important. We've got to talk about this incredible technology that you offer there, especially here in Tennessee. Explain what you're working with.
So what I'm the most excited about as a cardiologist is this technology that we're using, which is an AI-based technology where we can do non-invasive imaging in our office, and within about 5 seconds of scanning the heart can see everything going on in the arteries in people's heart. And then the AI technology is then able to look at that beyond what the human brain and eyeball is able to do and provide us really specific, exact information about plaque buildup, blockages, and then help guide therapy for people based on those results. One of the great things about our experience in our office too is that we have myself and my team at Young Heart Group there to give patients their results the same day. So they come in, they have a nice 30 to 60-minute visit with us, and then they're called later the same day with their test results and guidance about what the next step is for them.
Wow, same day, you can see it within 5 seconds. It's really incredible how far technology has come.
It's pretty amazing.
What happens after these scans? Like, what are the next steps? How do you continue to care for them?
So, obviously a lot of that depends on what we find, and it's been a really wide spectrum of what we found with these patients. So some people, they come in and they're very worried, and we're able to give them reassurance and say, your heart looks great, you're doing a good job, you don't have evidence of cancer, and then they get peace of mind and get to enjoy life without that hanging over their head. A lot of our patients, we end up identifying some plaque or blockage in the arteries that we're able to guide therapy based on that and prevent that problem from getting worse with time. And then about 10% of the patients that we've scanned so far, we've actually had findings that needed immediate attention and can be life-saving in that situation.
Do any of those stories, particularly successful stories, stick out to you?
Yeah, I probably have to share a pretty important one, which is my father-in-law. So my father-in-law was one of the first patients that we scanned, and he's asymptomatic. He lives over in Gatlinburg, Tennessee, and thought he was doing fine, and came in and had this scan done and had some really critical blockages, and literally one that we call a widowmaker. He's now almost 3 months recovered from bypass surgery, and even though he was asymptomatic before the scan, he feels so good now. He says he feels better than he's felt in a decade, so he really probably was symptomatic, but it had snuck up on him. So we feel very blessed and fortunate to have put him in the scanner and found those results, and he's going to live longer and be with us longer because of this scan.
That's great. Yes. What about those out there that may be hesitant to get a scan or scared?
Well, that's not uncommon, and sometimes people think, ignorance is bliss, I just won't worry about this. But the reality is we can identify exactly what's going on in people's arteries now and find out what their risk is and treat them accordingly. So I would just encourage people not to be scared. The test itself is quite easy. There's a little IV, that's it. That's the worst part of the test. Most people that come in, depending on their heart rate when they arrive, we give them a little bit of medicine to slow their heart rate down to get excellent pictures of the heart. And if their heart rate's good when they walk through the door, we had someone come in last week that walked in the front door and walked back out 23 minutes later. So it's quick, easy, just a little small needle stick in the arm, and that's it. It's very, very quick and not difficult.
Quick, easy, and saving lives. Thank you so much,
thank
Doctor.
you for coming
Thank
in.
you, I appreciate it.
Book your consultation today. Visit longevityhealthtn.com for more information and to get started.